Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about AMD foam dressing with border. But first, if you could hit that like and subscribe, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So the AMD Antimicrobial Foam Dressing with Border is a white polyurethane foam dressing impregnated with 0.5 PHMB designed to transfer the exudate into a secondary cover dressing. So the broad spectrum topical antiseptic is a foam that is effective against gram-positive and gram-negative, okay? So that's your MRSA, VRE, Pseudomonas, fungi, yeast, up to 7 days. Or if it does hit that saturation point, it can no longer it no longer has that antimicrobial effect, so you would have to change it. But it is good up to 7 days if it hasn't reached the saturation point. So we are going to use this dressing when we have a wound that has signs and symptoms of a local infection. So using your nerds and stonies, making sure it's a local infection. It can be used on a more deep spreading infection in conjunction with a antibiotic. Okay, but we're going to use this for local infections. This is all you need. Because it does have the PHMB in it, which is an antimicrobial. And the manufacturer did have no precautions listed, but contraindications. If somebody is sensitive to PHMB products, don't be using this. We're also not using this with Dankin solution or bleach solutions, as these products do deactivate the PHMB, so it will not work. And we're also not going to be using this on third-degree burns. So just like any wound, we're going to start by cleansing or irrigating the wound with sterile saline or normal or sterile water. And then you're going to dry off the peri-wound tissue, and you can apply a skin barrier if necessary. So to apply, you're going to choose a dressing that is going to cover the wound and extend onto the peri-wound by at least 5 centimeters, okay? Once that's done, you're just going to peel off the back because there's these little peels on the back. Peel the larger piece off first, place it directly on to the wound, centered, and then you will release the small piece of paper there. And then just smooth the border onto the peri-wound skin. So this can be applied directly as a primary dressing or combination with other products. Say you have a wound filler, you would put this over top of that. So to remove, you're just going to carefully lift the border, or if you have added tape to it, just gently remove the dressing. It should come up pretty easy. But like with anything, if you need to use some sterile saline just to kind of flush the areas that are actually stuck, leave them for 5 minutes and it will lift right off. Expected outcome is that signs and symptoms of infection are resolved within 2 weeks. Frequency of the dressing change, so this can be left in place for 7 days as long as it hasn't reached the saturation point. So when the saturation is within 1 centimeter of the dressing edge, that's when you change it. Okay, and then I did add the different formats and sizes here for you. And this dressing shouldn't be cut because anything with a border, the border is there for a reason, so it should not be cut. That's all that I have for this video. I hope it did help you in your daily practice. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So that's all I have, and I hope to catch you in my next video. See you guys.